we're in a pandemic. Some of us have either contracted COVID, know someone who has contracted COVID, gotten over COVID, have known someone who have died from COVID. Or you might be lucky and blessed to experience neither of what I've mentioned. But as I said, we are in a pandemic and there's questions, there's concerns, there's misinformation. But today, my hope is that we will leave here educated and that we will make informed decisions, that we can protect our health, the health of our loved ones, and the health of others. And please remember to share this link that we're live with your friends and your family members as well. I will be introducing the speakers in a little bit, but we're going to have our opening prayer at this time that will be done by Sister Diane Thomas.
Let us pray. If I have wounded any soul today, if I have caused one foot to go astray, if I have walked in my own willful way, dear Lord, forgive. Our Father in heaven, we come before you at this time to give you praise and thanks. We give you thanks for the word we received this morning through your servant, Dr. Stoddard. And now we wait for another word from Dr. Gloria. We are so thankful for your blessings today, which you promised us and which we have received. May our hearts and minds be open and receptive to what we will hear this evening. Bless the speaker and thank you again for your blessing. I pray in Jesus' name. Amen.
Amen.
Amen. And at this time, we'll be having, I say special music, but it's more our theme song going forward for the rest of this health series, Free by K. Anthony.
When I lift my eyes to the hills, I remember where my help comes from. There's no darkness that your light can put out. Your glory is my mercy, and forever I wanna be praising your name for how you set me free. Whom the sun sets free, oh, is free indeed. Everything I was, you cast into the sea. Your forgiveness is my only memory, as I simply be one whom the sun sets free. When I lift my eyes to the King, I remember all that matters. There's nothing that I've done where I can boast. I'd still be in chains were it not for grace. So I will sing of how you set me free. Whom the sun sets free, oh, is free indeed. Everything I was, you cast into the sea. Your forgiveness is my only memory, as I simply be one whom the sun sets free. I know you're true, and you call me completely healed and whole. I am yours and I know. Whom the sun sets free, oh, is free indeed. Everything I was, you cast into the sea. Your forgiveness is my only memory, as I simply be one whom the sun sets free. As I simply be one whom the sun sets free. Body, mind, and soul and spirit, there is nothing and no one that you can heal with your love. I know I'm
Beautiful.
In Jesus, we are indeed free. So at this time, I'm going to be introducing some special guests that we have. They're presenters. Before I talk about Dr. Gloria and Dr. Schwartz, I just want to make mention of Mr. Anthony Mingo, Sr., who is the Unit Manager in Community Outreach, Health Department Division. He has been instrumental in, with our church, communicating with different members of our church, that we can have this meeting possible today. So I just want to shout him out right now. Thank you. And our speakers, we have two. They'll be sharing together. We have Dr. Gloria. I won't try to pronounce the last names and embarrass myself, but Dr. Gloria, and we have Dr. Schwartz. Now, Dr. Gloria is the director of health for Fairfax County. So big role. In her capacity, she provides overall leadership and management and direction for public health programs for the Fairfax Health District. It includes the cities of Fairfax and Falls Church, and she has led emergency preparedness, health promotion, and community engagements initiatives, both at the regional and also at the state level. Throughout her public health career, she has advanced health equity, I know that she's passionate about that, and community resiliency through partnerships, and has successfully leveraged community assets to create innovative, practical, and sustainable community-based approaches to complex public health challenges. She got her medical degree from Tulane University School of Medicine, and she did her residency in preventative medicine from the Loma Linda University Medical Center. And if you should know, that's one of our Seventh-day Adventist institution. They're world-renowned for their medicine program. We have also Dr. Benjamin Schwartz. Dr. Benjamin, he's the director of the Division of Epidemiology and Public Health at the Fairfax County Health Department. He is also the Health Department's Deputy Incident Commander for the COVID-19 pandemic. So you see, we're getting persons who are experts. They know exactly what's going on to inform us. He also trained in pediatrics, infectious diseases, and public health. And before coming to Fairfax County in 2017, he worked at the CDC and at the Los Angeles County Department of Public Health. So I'm going to be turning over to them to share with us this evening. I pray that we will have open and receptive mind and that we'll all learn something this evening.
Amen. Thank you.
Thank you. Good evening, everyone, and thank you, Pastor Kennedy, for inviting us to participate in your Health Education Month program. The Fairfax County Health Department has truly enjoyed a long-term partnership with Emmanuel Worship Center, and we appreciate your participation on our Multicultural Advisory Council, as well as your contributions to ongoing efforts to promote community health and well-being. The most recent example being your willingness to take on a lead role in partnership with other houses of worship to help advance the health department's health literacy initiative. This is what public health is all about. It is what we do together as a society to create the conditions in which everyone can be healthy. And if there's one scenario that exemplifies the importance of everyone coming together to create healthy and safe communities for all, it is this pandemic. All the public health measures we are recommending to limit the spread of the virus, they work best when everyone in the community is doing their part, from hand washing to social distancing to masking and now vaccination, which is the best tool we currently have for ending the pandemic. We have 3 effective and safe vaccines that are available currently in this country. And yet we have not been successful in stopping the virus from spreading because for a variety of reasons, we don't yet have the full participation of everyone who is eligible for the vaccine. And therefore, we have not been able to achieve the highest level of immunity that is required to stop transmission of the highly contagious Delta variant and the surge in cases across our nation and right here in Fairfax. Tonight, our goal is to equip you with information that will help increase your understanding about COVID, with the hope that you also will share that information with your friends and your family who might still have lingering questions about COVID in general or about the vaccines. And I really want you to engage with us after Dr. Ben Schwartz delivers the main presentation. As you've heard, Dr. Schwartz is a colleague of mine at the Health Department, and he's the Director of Epidemiology and Population Health. So thank you, Ben.
Thank you, Dr. Gloria. And Dr. Gloria is always so eloquent and always so well-spoken. It's always difficult to follow her. But let me spend a little bit of time tonight talking with you about COVID vaccines, about the COVID pandemic in Fairfax County, and as Dr. Gloria says, how we can work together to end this pandemic in our community. Could somebody put the slides up, please? Thank you. There you go. Okay, so what we'd like to talk about this evening is about COVID-19 disease, and then an update on prevention focusing on the vaccine. Next slide. So what this slide shows is the last 6 months of the pandemic in Fairfax County. And the taller the bars, the more cases of COVID-19 it represents. So if you think back to March of this year, we were just coming down from a large peak of disease that we had last fall and last winter. And so in March, April, and May, we were pretty much on a plateau. And then as more and more people in our community got vaccinated, rates of disease declined so that in mid-June, there were fewer than 10 cases each day in Fairfax County. everything was really looking wonderful. But then, unfortunately, as we moved into July, August, and now into September, you can see the number of cases once again going up. And next slide. The reason for this increase, as many of you I know already understand, is the spread of the Delta variant. So shown in the colored bars at the top of this figure are the variants in the United States as measured by CDC. The orange bars are the Delta variant. And you can see again nationwide, it began to emerge this summer and quickly has become the predominant strain, so that at the end of August, over 99% of all infections in the United States were caused by the Delta variant. Now, this variant stands out because it is so much more contagious than previous COVID strains, and twice as contagious as the original virus that we experienced over a year ago, and more than 50% more contagious than the Alpha variant, which had become our predominant strain last winter. Next slide. The Centers for Disease Control and Prevention defines 4 different levels of community transmission, going from low through moderate, substantial, and high levels based on the number of cases that are occurring in the community and based on the proportion of the tests that are reported as positive during the past week. Next slide. Back in June, when we were at that low point in pandemic disease, in Fairfax County, our level of disease transmission was low. But since then, it has moved up through moderate, substantial, and now in our community, we are back at a high level of transmission. And this is important because it really emphasizes the use of all of our mitigation measures, so that, for example, even people who are vaccinated are recommended to wear masks indoors when transmission in the community is either high or substantial. And so that is one of our current recommendations. Next slide. But the impact of COVID goes beyond merely the number of cases that have occurred and the hospitalizations and the deaths that have gone along with that. There are health impacts such as long COVID or ongoing symptoms that may occur in as many as 1/3 of people following their infections. People report having loss of taste and smell, headaches, other symptoms like fatigue, brain fog, that go on for months after the infection. And many people, when asked 6 months after getting COVID, they tell us that they have a reduced quality of life compared with before they became ill. There also have been mental health impacts. Certainly, we're all familiar with the economic impacts and the inability of many families to meet their basic needs. And then the educational impacts, as children had been out of school for over a year before this school year just began recently. Next slide. But we know how to end the pandemic. And we know that the pandemic will end when enough people are immune to COVID-19 so that the virus can no longer spread in our community. And the way herd immunity or community immunity works is when no people are immune, when everybody is susceptible, one can have these very long chains of transmission where one person spreads the virus to another and they spread it to another, and these chains just keep on going. But when many people are immune, these long chains of transmission can no longer occur because people who get sick are only in contact with other people who already are protected and who are immune to the infection. And there are two ways that we can become immune. One is to get COVID disease and to risk hospitalization, to risk death, long COVID, or the other way is to get the COVID-19 vaccine. Next slide. So many people in our community have already chosen to get vaccinated. In Fairfax County, over 788,000 people have received one dose at least. And among adults who are aged 18 and older, this represents almost 80%. And you can see that our vaccination rate is even higher among adolescents than among adults. And fully vaccinated also are over 700,000 in our community. Next slide. But even with these high numbers of people vaccinated, given the population in Fairfax County, what this means is that we have almost 400,000 people in our county who remain unvaccinated. About half of them are children who are too young to be eligible for vaccination, but the other 200,000 are people who so far have not chosen to get the vaccine. Next slide. One of the questions that frequently comes up is, does the COVID-19 vaccine work for the Delta variant? And the answer is a definite yes. There is very high effectiveness of this vaccine, particularly against serious illness that results in hospitalization and death. We know that breakthrough cases do occur and that some vaccinated people become infected. But number one, that is not common. And number two, when they do get infected, the severity of their illness is less. Thus, a large majority of the cases that still occur are occurring in people who are not vaccinated. Next slide. I want to go into the information about unvaccinated people a little bit more and talk about the lack of vaccination among groups by age, by race, and ethnicity. And let me first orient you to what's shown on this slide. So this slide shows the population that is unvaccinated. So the taller the bars, the more people who have not received vaccine. The blue bars are the Hispanic population in Fairfax County. Orange is Asian, American, and Pacific Islanders. Gray is the white non-Hispanic population. And in yellow is the African American and Black population. And so what you can see is that among adolescents and adults, the rate of vaccination among the white and the African American populations is less. In other words, more people are not vaccinated, taller bars in those two groups, compared with the Hispanic and the Asian Pacific Islander population. Now, it's interesting that among older adults, those who are 65 years and above, there is not much difference in rates of vaccination. So older people, recognizing their higher risk for getting COVID and having severe COVID disease, there's less variability in vaccination by race and ethnicity. But among the younger population, again, those who are white and those who are African American are much less likely to get vaccinated. The health department has had a number of conversations in the community with the African American population in barbershops and hair salons, in other venues, as well as information that we have from other jurisdictions around the country. And one of the things that we've learned is that one of the barriers to people choosing to get vaccinated is a lack of trust. And it's certainly understandable given the historical and the ongoing impacts of racism, the systemic racism, the differences in medical care in our society, the history of medical experimentation. But it's both a lack of information as well as a lack of trust. And I hope we can talk a little bit more about that in this conversation tonight. Next slide. So I want to move on and talk a little bit about the vaccines and talk about the safety of the vaccines and to dispel some of the myths that people may have about vaccination and its safety. Next slide. The mRNA vaccines, those vaccines from Pfizer and from Moderna, work by providing the information that allows our body to make the spike protein, which is the piece of the COVID virus on the surface that results in our human's immune response. The instructions, the mRNA for this spike protein, are packaged in a lipid particle and given in the vaccine. And these particles are picked up by our cells. They take this information and they make the spike protein and then display the spike protein on the surface of those cells. Our immune system then makes antibodies, and these antibodies can protect us if we are exposed to the COVID virus. Next slide. Given the way these mRNA vaccines work, there are several important facts about the vaccine that are really important. First, you can't get COVID from the vaccine because there is no live virus in the mRNA vaccines. It only contains the instructions that allow our body to make those spike proteins. Secondly, the mRNA in the vaccines does not interact with our DNA in any way whatsoever. The mRNA never enters the nucleus of the cells where our DNA is kept. Third, our cells break down and get rid of the mRNA after we are finished using the instructions, and therefore there is no long-term effect on our bodies. And then finally, I think it's really important that we separate myths from facts. For example, vaccines do not contain a tracking microchip. Vaccines cannot make you magnetic. And there are many other myths that you may see on the internet that just are not true about these vaccines. Next slide. One of the questions that people frequently ask is, how could the new COVID-19 vaccines be made so quickly? And there are several reasons why this was possible. First, the mRNA and the adenovirus vector vaccine technologies had been studied for more than a decade before the pandemic. And so therefore, once the pandemic occurred and COVID-19 came along, scientists were able to use this same well-studied approach with this new virus. In addition, the government made a lot of money available to the vaccine companies that allowed them to work more efficiently. So for example, while they were doing the clinical studies that proved that the vaccine was safe and effective, they were also building up their manufacturing capacities so that they could have the vaccine available once it was approved. It's important to emphasize that no corners were cut in evaluating or approving these vaccines. It was the same process as used for other currently licensed vaccines. Next slide. So what about people like me? Was this vaccine tested and proven to be safe and effective in people in my age group, people of my race or ethnicity, people with my same underlying medical conditions? And the answer to the question, again, is yes. Each of the vaccines was studied in clinical trials that included over 30,000 people. And these studies included men and women. They included people of all ages, racial and ethnic groups, as well as people who had underlying medical conditions and those who did not. And what was found in these studies was that the vaccine was equally effective and equally safe in all of these different groups. Next slide. So what are the risks? And we know that people's number one concern is the safety of these vaccines. And we have really a lot of experience with the COVID-19 vaccines. There are over 200 million people in the United States who have been vaccinated with over 360 million vaccine doses. So this really gives us a lot of experience studying the safety of this vaccine. And I will say, more than any other vaccine that has been studied, the CDC, our government, has really done a very, very intensive job studying the safety of this product. Next slide. So what do we know and what don't we know? We know first that many people who get vaccinated have pain in the arm where they received the shot, and some of them have reactions like chills, headaches, muscle aches, or tiredness. And these reactions are short. They generally occur for 1 or 2 days, and then they go away completely. We also know that rarely people have an allergic reaction to vaccination, which can be treated. And for the Pfizer and Moderna vaccines, we know that there have been cases of myocarditis that have been associated with vaccination. And I'll spend a little bit more time talking about this. As more and more people have gotten these vaccines, CDC has continued to track whether other side effects occur, as they do with all other new vaccines. And for the mRNA vaccines so far, they have found no other significant side effects. Next slide. So let me just say a few words about the allergic reactions. A severe allergic reaction, also called anaphylaxis, occurs after vaccination in about 5 out of every 1 million people who receive an mRNA vaccine. And this is related to an allergy to a vaccine component. It is not related to food allergies. It's not related to egg allergies, to bee sting allergies. It's unrelated to latex allergies, but it may be from a specific allergy to a vaccine component. And again, it only occurs rarely. There are several steps that are taken when vaccinations are given that can help reduce risk. So people should be screened for whether they have had allergic reactions and allergies to what. And then after they're vaccinated, everyone needs to wait 15 or 30 minutes. So if a reaction does occur, it can be seen and it can be treated. And treatment is always available where vaccines are given if a problem should occur. Next slide. One of the other concerning side effects that people have noted is myocarditis or pericarditis that follows receipt of an mRNA vaccine. Myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the lining of the heart. The symptoms of this side effect include chest pain and shortness of breath, and it generally occurs within 6 days following vaccination. In general, patients who have this are hospitalized for about 2 days, but recovery tends to be very rapid. And the CDC has tracked people who had this side effect, and the large majority of them get out of the hospital very quickly. This side effect is most often seen in young men, generally after they receive their second dose. And the best data collected by CDC suggests that there are about 16 cases per million people who are between males who are between 12 and 39 years old and receiving their second vaccination. It's worth noting that myocarditis also occurs after COVID-19 infection at a higher rate than it does after the vaccination. Next slide. So I want to talk a little bit about balancing benefits and risks, because it's often easy to focus on the risks without doing the balancing between what is the benefit of vaccination and what is the risk of vaccination. And I'd like to just give a brief example of how we do this every day. So if we're eating dinner and we think about, should we have dessert or should we not have dessert? We're doing a risk-benefit calculation. We're saying the benefits of having dessert are, tastes really good. We really like dessert. But the risks are if we have too much dessert or dessert too often, it may not be healthy for us. So we make a choice, weighing the benefits against the risk. And we need to do this with COVID-19 vaccine as well. And so shown here on the slide are some of the numbers to do that balance between the benefits of vaccination and the risk of myocarditis. So in the population that's at greatest risk, males who are 16 or 17 years old, following vaccination for 1 million people, there may be 73 myocarditis cases. But compare that with, in a 120-day period, over 56,000 cases of disease that would be prevented, 500 hospitalizations prevented, 170 intensive care unit admissions prevented, and 4 deaths prevented. And you can see that in the older population, the benefits are even greater and to an even greater extent outweigh the risks of myocarditis. Next slide. There are many other things that people may have heard about vaccination, and I'd like to dispel just a couple of those myths. Next slide. The first is, does vaccination affect fertility? And again, the answer is very clearly, it does not. In the Pfizer vaccine trial, there were 23 women who became pregnant during the trial. There were 12 in the group that did not receive the vaccine, and there were 12 in the group that did receive the vaccine, and there were 11 in the group that did not get vaccinated who received a placebo. So no effect on the ability to get pregnant among women included in that trial. The American College of Obstetricians and Gynecologists, the doctors who are most expert in women infertility, and the American Society of Reproductive Medicine have looked at this and other evidence. And they state, we continue to recommend that the vaccine be available to pregnant individuals. We also assure patients that there is no evidence that the vaccine can lead to loss of fertility. And they go on to say, no loss of fertility has been reported among trial participants or among the millions who have received the vaccines since their authorization. Next slide. Some people also worry, is it safe to vaccinate adolescents? As adolescents are growing so rapidly, should they really be receiving vaccines? And the answer here is yes, that it is safe. There are currently other adolescent vaccines that are recommended by CDC and by the American Academy of Pediatrics. And adolescents naturally encounter germs every day that stimulate their immune response without any problems. And so receiving a vaccine to stimulate an immune response for that one substance is no particular strain on their immune system. Next slide. There are several recent issues and upcoming issues with respect to vaccine that I want to highlight. First, there have been a couple recent changes that everyone in the community should know about. The first is a recommendation for a third mRNA vaccine dose for people who are immunocompromised. So this already has been approved by FDA and recommended by CDC. So if you have an immunocompromising condition, please get that third vaccine dose to improve its effectiveness. And then recently, just a couple of weeks ago, the FDA afforded full approval of the Pfizer vaccine for people who are age 16 and older. So they've gone from the emergency use authorization to full approval, just as they have for other routinely used vaccines. Some upcoming issues are a potential booster dose for people who received an mRNA vaccine 8 or more months ago. And CDC and FDA will be considering that sometime hopefully later this month. There also is consideration of additional dose or a booster dose for the Johnson & Johnson vaccine. And then the vaccine manufacturers are finishing studies looking at vaccination for children who are between 5 and 11 years old. And hopefully that will be recommended later this fall. Next slide. Now, while I've talked the most about vaccination, because again, vaccine and immunity is our best approach to getting out of the pandemic, I want to emphasize that there are other key prevention strategies that we need to use along with vaccination to achieve the highest protection in our community. And those measures, as you can see here, include the consistent and correct use of masks, physical distancing, screening, testing if you're ill, the good ventilation, hand washing, clean facilities, staying home when you're sick, and contact tracing by the health department in combination with isolation and quarantine. So by layering these strategies together, we can effectively drive the number of cases down as much as possible. Next slide. Now, while masking has been politically controversial, there is no controversy in the science supporting its effectiveness. In a recent publication, CDC stated that compelling data now demonstrate that community mask wearing is effective as source control, in other words, preventing the spread from infected people to someone else, but also protecting the wearers who may be exposed to infection. And shown on the right are 11 different studies that have used different methods, that have occurred in different countries, all of which show that masking is effective. And let me highlight a couple of them. In one study on the aircraft carrier, the Theodore Roosevelt, they studied individuals who had worn masks and individuals who had not worn masks. And what they found was a 70% reduction in the risk of infection among the sailors who wore masks. In counties in Kansas, in another study, they compared disease in counties that had a mask mandate with counties that did not have a mask mandate. And they showed that in counties where there was a mandate, disease went down, and in counties where there was no mask mandate, disease went up. And so again, a number of different studies, different places, different methods, all supportive of masking. Next slide. So I want to end by highlighting what you can do to help as we try and improve prevention and protection throughout our community. First, if you're not vaccinated, please get the information that you need to decide whether vaccination is right for you. And at the health department, we can provide this information. You can talk with your doctor. Look at reputable sources on the internet, like the Fairfax County Health Department's or CDC's webpage, but get the information you need in order to make a good decision. Secondly, if you are vaccinated, please share your thoughts and your experiences with family and friends. We've been collecting information from people who are getting vaccinated in our community and asking them what was influential to them in making a decision to get vaccine today. And about a third of them say that it has been information from family and friends that is very important in their decision to get vaccinated now. And then finally, it would be great if you could act as a vaccine champion, reaching out to others and directing them to vaccination locations, or even helping them to sign up. And there are more than 200 locations in Fairfax County where people now can get vaccinated, at health department clinics, at other locations in the community, pharmacies, grocery stores, etc. And these vaccine champions, or we call them at the health department, we call them vaccine navigators, can meet people at opportunities such as food distribution events or other community settings and talk with them about vaccination, give them the trusted information that may help them make a decision. One thing the health department would be pleased to offer is training in order to give people the tools and the information that can help you be more effective as a vaccine champion or vaccine navigator. And if anyone is interested in this, please reach out to us and we can work with you to arrange that. Next slide. So that's all I wanted to share this evening. I thank you so much for your attention. And Dr. Gloria and I would be happy to answer any questions that you have.
Thank you all. If we could stick to that slide one more time and go to slide number 9. I saw a question while Dr. Schwartz was talking, and maybe he can elaborate on that slide. Slide number 9, yes, that one. So the question was that, let me read it exactly so that I don't make a mistake. It says,
I know that you've already said this one will have no bearing on.
It says that the percentages do not add to 100. So if you could explain this slide a bit more, Ben.
Yeah, I know this is a little bit confusing. So what each bar shows is the proportion of people who are unvaccinated. So let's look at African-American adolescents. So among African-American adolescents, the bar goes up to about 38%. So 38% of 12 to 17-year-olds who are African-American have not yet received vaccine, and the other 62% have been vaccinated. Among adolescent Hispanic youth, there are 12% who have not been vaccinated, which means that the other 88% have received the vaccine. So what each bar tells us is the proportion of people in that group who remain unvaccinated.
Thank you. So just to reiterate, the idea is not to have the bars add up to 100. Each bar is its own, you have to look at each bar independently.
Right, and we want the bars to be as short as they possibly can be, which means that we're getting more people in our community vaccinated.
Thank you for explaining that. Are there any questions for us, please?
I have one question. I have a question for you, Doctor. Are the studies of COVID, what are the studies of COVID-19 and arthralgia?
Do you mean the vaccine and arthralgia?
Not the vaccine, but say, for example, if one contracts COVID-19 and they develop arthralgia or had arthralgia before COVID-19, does COVID-19 increase the symptoms of arthralgia or?
Arthralgia, I can't say whether it ever does or doesn't, but the symptoms of COVID-19 generally don't include arthralgia as a symptom. They may include muscle aches, headaches, fatigue, fever, cough, shortness of breath. I've not seen arthralgia being emphasized as a symptom, so
okay.
It may not be a common symptom of the disease.
Okay, thank you.
Yes, Jamie Blair has a question. Ms. Jamie, would you like to say your question?
Yes, my question is, how well will the vaccines protect people with weakened immune systems, including people who take medicines that suppress the immune system, for example, chemotherapy and radiation, when that indiscriminately kills the white blood cells? How will they be affected?
CDC has some data on people who have weakened immunity because of disease like cancer or medications that people take, or people who have received an organ transplant. And what the studies showed is that overall, the level of protection with the mRNA vaccines was around 70%. And this is compared to 95% for people who do not have a weakened immune system. So that there is some protection, but it's not as high as for people without immune suppression. Now, that's the reason for the recent recommendation that people who have weakened immunity receive a third vaccine dose to boost that immunity and to increase protection.
Thank you. And how long will the COVID-19 vaccines protect people?
The studies show that the protection decreases over time. And one of the reasons that there's been a lot of discussion recently about getting a booster dose after 8 months is that the effectiveness in some people becomes lower as they approach that 8-month point. And that may be particularly among people who have weakened immunity or who are older.
And is there a way to test that? Are we able to go in and get tested to see how our immunity stands up against this virus?
Unfortunately, we can't do that because we don't know what antibody level, what level of immunity correlates with protection. And so we can measure antibody levels, but we can't say, given a level of X, Y, or Z, that means you're protected or not protected.
I see. Thank you. Thank you, Doctor.
Yes, there is another question in the chat.
So if I may add to that question, the waning immunity is also experienced after natural infection as well. Mm-hmm. So either natural infection or vaccine doesn't give you long-term immunity. And we're still studying, the scientists are still studying that issue as well.
And we find that with other viruses like influenza. And so with flu, part of the reason why we're recommended to get vaccinated every year is because our immunity decreases over time since vaccination. So this is really not unexpected.
That's correct.
Okay, there is another question in the chat. Can COVID-19 infection be prevented through natural remedies such as non-pharmacological intervention and behaviors addition in addition to masks?
So there are certainly behaviors that can reduce our risk. For example, physical distancing from people and avoiding crowds indoors. So that, again, these layered strategies can help us reduce the risk of COVID-19. But really, the way that we can protect our community most effectively over the long term is by getting vaccinated, by increasing immunity. We really want to get away from having to do all of these mitigation measures. Everybody wants to return to normal. And our chance of returning to normal is really through that population level immunity. And that comes either through vaccination or through getting disease. I also want to point out that, not everybody can get vaccinated. And so young children can't get vaccinated, infants can't get vaccinated. And so by protecting ourselves from infection, we protect others who cannot be vaccinated, because by us not getting sick, we then can't transmit disease to somebody else.
Thank you. There is another question in the chat. How long will the vaccine be free?
I don't know how long it will be free, but certainly now is the time to take advantage. And as the question points out, there is no cost of vaccination. There is no copay. There's no cost for the vaccine substance itself, nor is there a cost for vaccine administration. And that's true whether you get vaccinated at a pharmacy, a grocery store, or at the health department.
Okay, I see someone has a question, has their hand raised.
Yes, thank you. Based on your charts, there's still quite a number of unvaccinated people in the county. And you talked about particular groups who are represented even more in that particular unvaccinated group. What are your plans going forward to reduce that number?
Yeah, that's a great question. And we've been working very hard in the community, working with partners like Neighborhood Health, other partners like George Mason University, Health Department outreach. And we've had vaccine clinics for in apartment complexes, in neighborhoods, in churches, other houses of worship. And so we're really working to bring vaccine into the community where it's more convenient for people to get vaccinated. But in addition to making vaccination more convenient, we have to talk with people about vaccination and overcome their concerns, answer their questions, provide information. And this information needs to come from trusted partners. And the health department has an outreach team, and our outreach team has gone to hair salons, to barber shops, holding conversations with people. We've gone to events in the community where food is being distributed. We have what we call vaccine navigators who, again, go out into the community, may go door to door within apartment complexes and neighborhoods to provide information, to answer people's questions, and to be a trusted source of information. Dr. Gloria, do you want to add to that?
No, yes, I think that that is exactly correct. And that is why we are here tonight. We don't know the 1.2 million people in Fairfax County, but as Dr. Schwartz mentioned, as we've been surveying people who are now coming in to get their vaccines and trying to find out from them why now. Many of them cite family, friends, their private doctors, and so on as the reasons for changing their mind and helping them make that decision. So we are also talking to our partners who we know are influencers of their family, of their friends, and others within their community to really join forces with us. As we've been saying, when we reach out and have these kinds of conversations with people like you, we hope that you will in turn be a source of information to someone that you know who is either has questions or doesn't have the right information. You know, in the book of Hosea, chapter 4, verse 6, it says, "My people are destroyed for the lack of knowledge." There is just so much misinformation out there that is really clouding people's judgment to make that risk-benefit analysis that Dr. Ben talked about, to make that decision for themselves. In the meantime, we have a virus that is raging through our community. And, this virus will not stop. These pandemic viruses, they will not stop until, if they get their way, they will not stop until they've reached or gone through every single person who is susceptible. And we've seen the impact that having hundreds of thousands, millions of people get infected and sick, we have seen the impact in our community and across the world. Just in this country alone, over 500,000 people dead. People who, on December 31st of 2018, just had such a bright future. And like all of us, we're looking forward to big things in their lives and are no more because of this virus. Mm-hmm. So it's going to take all of us, as we talked about earlier on about what public health is, all of us doing our part. Yes, the health department is doing the things that Dr. Ben mentioned, but we can't do it alone. For some people who still have issues about the vaccine, we are not the trusted mouthpiece, but you are. And so we are hoping that you will join forces with us and talk to people that you know in your environment about COVID and about the vaccine.
Dr. Gloria, I know somebody has a question, but I think it's an appropriate time for me to say a word of affirmation about our congregation and about the kind of work and the kind of trust both to yourself, Mr. Mingo, and others in your department who have entrusted to Emmanuel Worship Center the privilege of participating as a partner in partnership in order to be able to participate in this venture of educating the public. In fact, it's very interesting that at this particular time, when the Health Month information was planned, it's about that time, I need to make a confession. When you sent out the first request concerning partnership, I saw it. Dr. Blair became ill about that point, and I decided to walk away. 2 weeks afterward, through Nikki evidently spoke to Mr. Mingo, and once again on yourself, and you reached back out to us because of your trust in the kind of work that we are able to do. And at the moment, I want to tell you that I'm proud of the congregation. And if I tell you the percentage of vaccinated in our congregation is very high, nearly up to 100. And it is true that sometimes we have a couple individuals who are dragging a little bit their feet, but we're hoping that we can move the 1 or 2 persons who are having that kind of challenge to be able to spread beyond our congregation the conviction that vaccinations are helpful. And as I would like to say, our conference sent out a letter this very week to inform pastors. We cannot write letters to say that the vaccination, our Seventh-day Adventists do not believe in the vaccinations. So nobody can come to me and ask for a religious liberty exemption from the vaccination. They cannot. I will not write it. No other Seventh-day Adventist pastors are allowed to write such a letter, because the stance of the church is vaccinations, COVID-19 vaccinations are important. I turn over to the person who wanted to ask a question, but I want you to be very much aware where we are in support of the kind of venture that you're launching.
Okay, Shalane has a question.
Hi, good evening, Dr. Schwartz. Good evening, Dr. Gloria, and good evening to everyone that's on the forum this evening. My question is, if someone already had the COVID-19 virus and recovered, say like a time frame of March of 2020, and they developed their own immunity and they went for testing, and it is still almost the percentage numbers is correlating with what Pfizer and Moderna are putting out. Do they still have to take the vaccine? And if so, which one would you recommend them to take?
So the studies show that people who have natural infection, their immunity goes down over time. And it also shows that people who have had infection and get vaccinated, that it boosts their immunity. So even if you have antibodies, even if you have good antibodies, getting the vaccine will boost those antibodies to a higher level. The studies also show that vaccination gives you broader protection against more different variants than natural infection does. So if you were infected, if someone was infected in March of 2020, or even this recent March, before the Delta variant, getting vaccinated will increase the protection against the viruses that are now circulating in our community. My recommendation in terms of vaccine type is that all of the vaccines are very good and very effective at preventing severe disease and hospitalization. The mRNA vaccines, the vaccines by Pfizer and Moderna, may be a little bit better in preventing any type of COVID infection. And also, those are the ones where the booster dose is more likely to be recommended. So if I were getting vaccinated, those would be the two manufacturers that I might choose.
Okay, thank you very much, Dr. Schwartz. I greatly appreciate it.
Okay. I see Jamie Blair has her hand raised.
Yes, thank you. What vitamins are recommended to take in order to boost our immune systems? And how many milligrams and IUs should we take respectively, and how often?
Yeah, you know, a lot of the focus and attention on vitamins and immunity has focused on vitamin C, but I want to emphasize that vitamin D is a vitamin that has been shown very clearly to increase immunity. And so that would be one that I would recommend. In terms of the amount, it's kind of based on what your body needs. And vitamin D levels is something that when you see your doctor that can be measured. And you know, many people will be fine, and others may need to take some amount. And so I think that's something you should talk about with your healthcare provider.
Thank you.
Yes. I also have a question. What is the transmission rate? How does the COVID transmission rates differ within the population of children? Because I've heard that sometimes the transmission rate in children is different from adults, and as well as within the schools and daycares and things like that, especially since children under the age of 16 are not able to get vaccinated. I think the teachers have to get vaccinated, right? But
Right.
not the students.
Yeah, so teachers are going to be mandated to get vaccination. And then the Pfizer vaccine can be used in children who are 12 years old and older. With the original virus a year and a half ago, there were studies showing that children were less likely to get infected. But the Delta variant, the strain that we have now in our community, appears to be more frequently infect children. And so I think the way I would have to answer your question is we don't really know the answer for the Delta variant and whether it's transmitted as easily between children as it is among older individuals. But certainly one thing that we do know is that vaccination is effective in decreasing that transmission. And again, hopefully vaccine will be available for school-age children coming up later this fall.
Okay, thank you. And I also have another question. I heard that there's another variant in addition to the Delta variant. Is that true?
There are a couple different varieties of Delta variant, but the Delta variant right now is over 90% of the infections in the US.
Okay.
There certainly are other variants that are out there, but because the Delta variant spreads more rapidly, it kind of pushes all the other ones aside and becomes the major one in our community.
Okay. Thank you.
And I see that Sister Kay hand is still up. I'm not sure if she has another question or not.
Yes, I do have another question. I'm somewhat obsessed with the unvaccinated. So my other question, I have a two-part question regarding the unvaccinated. So Dr. Gloria had stated that when people are coming in, the question is being asked, what took them so long? And I'm curious to know what are some of the answers. And I'm also curious to know if an answer is after a family member or a friend have died or have gotten seriously ill, that caused them to come in. And I also saw that the unvaccinated rate between whites and African Americans are similar. And so I'm wondering if they have similar reasons, or do their reasons differ widely?
Yeah, those are both really excellent questions. So your first question was, remind me just quickly.
So the question was about why, the study that we've been doing.
The study, yeah, yes. Exactly. So in the study, we asked people why they waited so long and then why they got vaccinated today. And reasons for waiting so long, the number one reason was concern about the safety of vaccines. And some people still were concerned that the vaccines were made too quickly. A number of people talked about it being inconvenient to get vaccinated earlier. Some people talked about a perception that they were unlikely to get disease. So there were a variety of reasons having to do with the disease and concerns and information that people cited as to why they waited. The reason why people then chose to get vaccinated was the flip side of that, so that it was easier, it was more convenient, that they had gotten the information they needed about vaccine safety. Many people, over a third of people, said that the reason they got vaccinated was because of the Delta variant, and that this was the single most important reason they now chose to get the vaccine. When we asked people about their trusted source of information, and we looked at this specifically for the African American community, we found that for about half of them, their most important trusted source of information was CDC. For about a third, it was the county health department. And also for about a third, it was family members. And so again, really emphasizing the importance of, talking with people in your family if you have been vaccinated and sharing why you made that decision and how you responded to the vaccine. And then the second question was about the reason why the non-Hispanic white population has not gotten vaccinated and how that compares with the African-American population. So we have, some studies have been done, and I think with the white population, it tends to be more of a political issue, that we find that many of the conservatives, many of the Republicans are more reluctant to get vaccinated, that vaccine rates are lower in those populations. And that may be because of a lack of trust in our current administration, our current government leadership. Among the African-American population, as I had mentioned earlier, studies that we and others have done have really highlighted the need for information and the trust that people have in where that information comes from. And again, that's why it's so important for trusted voices to reach out into the community.
Mm-hmm.
So I want to say a special thank you to Dr. Gloria and Dr. Schwartz. It was surely an informative session. I'm glad that many of our questions, almost all our questions, were answered today. I hope that a lot of the misconceptions that we have regarding the vaccine has been cleared up for you. And I pray that we will share this information that we have with friends and family. I want to end with a closing prayer from our pastor, and just a reminder that if we need more information, remember we can visit the Fairfax County Health Department site, and there's a section for frequently asked questions, but you can also call the call center and you can have your questions answered directly. And also in the chat, I wanted to make note of what Nikki had mentioned, that they are vaccine navigation team specifically dedicated to the African diaspora community, which I think is good. I mean, a lot of times the minorities tend to be looked over or they have a lot of trust issues. So I'm glad that there is a team that's dedicated to getting persons on board. And just a reminder as well, with all the different measures that are put in place, we should follow, and along with the vaccine, along with also the different things that we've been learning about throughout last night and also this morning presentation. So at this time, I'll ask our pastor to pray to close us out.
Once again, I need to say thanks for your efforts. And also thanks to Dr. Schwartz, Dr. Gloria, for the confidence, and Sister Nikki. That's how we call her in our congregation now. A couple of weeks ago, we had the privilege of praying over her babies, her children, in our congregation.
It's beautiful.
And we made her aware that her father lost her father this week and was buried yesterday, that we were praying for her. So I want her to know that if she's online listening. I think she was online listening at some point. So we want her to know that. And we want to thank God for the team that we do have. A lot of our nurses, Camelia herself, Felicia, they work at Innova Hospital and different places in the county. Maria, Maxine Johnson, they work in nursing homes in the county, and different ones work in different places. We need to pull Jean back into the county. He's working for Los Alamos in Mexico, New Mexico, but he is living in the county and working for us. Jean is doing an excellent job. in the area. He has his master's in public health from Johns Hopkins University. And so we try to keep him in the county so that he can also participate. And we want to thank God for each one. Some of the questions that were coming from different kind of professionals, social workers, a lot of nurses, as you know, very heavily laden in our congregation, and we're happy for the emphasis. Next weekend, we continue our health education month. I forget the themes right now, but they're all published. People can go online on EWCSDA.com and they can find this very presentation. I think it will be online. Am I correct, Brother, Sister Camila? And she's also going to send out a link right after this service. She'll send out a link tonight that can be shared with individuals, so individuals can listen to this presentation and share it with their friends. Thank you. Let us pray. Thank you again, God, for your mercy, your kindness, your love to us. And thank you that while we accept that you are the healer, yet you use instruments here on earth and methodologies that you have revealed to humanity in order to make it possible to deal with the challenges that we face. This pandemic has really challenged us. And we're asking you that you'd even give us the tools so that we can be able to have the kind of wisdom that when we see all of the misinformation online, we will not follow that, but we will seek right information, trusted information. We're asking for your blessings even now, we pray. Thank you. Guide us on our homeward way in the name of Jesus Christ.